starts with a fresh shot of espresso. Bold, rich, pulled just right. Then comes the milk, steamed smooth, creamy, and balanced. The perfect latte is not rushed. It is crafted, one cup at a time. Your perfect latte is ready. Coffee first, then everything else.
Good afternoon. Welcome to Beyond the Headlines. I'm DJ Moises, and today's conversation is brought to us by Coffee First. Measles and rubella are diseases many people think belong to the past. Yet today, health authorities are once again urging parents to have their children vaccinated through the Measles-Rubella supplemental immunization activity. Why is another campaign necessary? And what should parents know to make informed decisions for their families? Today, let's look deeper and think better. Joining us is Medical Officer 3 Regional National Immunization Program or NIP Medical Coordinator from the Department of Health, Dr. Faith Curaraton. Hello, Dr. Faith. Welcome to Beyond the Headlines.
Good afternoon, and thank you for giving us the opportunity to be here.
Yes. So for the sake of our viewers, because they will see the initials MR-SIA, that actually means Measles-Rubella Supplemental Immunization Activity.
Yes, that's correct. So it's more on just a supplement to give to the kids or booster if let's say it's it's more on the booster to boost your immune system of your children.
So if parents are watching, Doc, and then they would be asking, like, didn't they already have the vaccines before, or the program was already administered before? So why the need for a boost this time?
Okay, why do we need to do the boosting again? The MR or measles rubella has been given to us since 9 months and 12 months of age, but not all children were given, meaning not all the families opted to get that vaccine. So we are afraid that these children might be the ones to cause an outbreak or cause the measles infection, and it can spread wildly among other children. So in order for that not to spread that much, we need to immunize again these children. But actually, it's the same vaccine.
So, Karen, what I have here, the numbers that I have, and then you can correct me now if I'm wrong, but the Philippines currently is struggling to reach the 95% coverage needed, no?
Yes,
to prevent
that's true.
outbreaks, no? So, why are we still relying on supplemental rather than addressing the gap?
Okay. We are still relying on that because, again, you have said we haven't reached the 95%. Why 95%? Okay, let's just put 10 people or 10 children in a classroom. All those 10 children are healthy, young, but one of them has measles. Now, on that next day, once that person has the measles, 80% will have the children, 80% of that class will have measles. And the very next day,
Because of just one,
95, because of just one. And then the very next day, 95 to 100 will have measles, meaning most of your kids will be absent. So that's why we are trying to reach the goal of the 95%. So it's not just the numbers that we are trying to reach, but it's more on having more children to be vaccinated.
If you don't mind, Doc, where are we currently?
We are so at the low point right now. So meaning we are afraid. We in the
Like, how many percentage lang?
partially it's more on the 20%.
Now I understand the urgency.
So we really need to, that's just Central Visayas. So that's just the partial numbers that we got. It's not like the full, because we really need to get the full detail of it. So since the data that we can gather is really that slow, that's why it's still partial. So it's still at the 20 percentile, and we are afraid that we might have an impending, meaning an upcoming
Or
outbreak
we are
that,
vulnerable.
yes, we might be vulnerable for an outbreak or a measles infection. And the complications of this might be so debilitating to those kids who haven't had any kind of vaccination at all.
So, what do you think are the challenges, Mandoc? Why immunization level is not reaching enough children? No?
There's so many challenges. It could be the leadership and governance, or it could be the mothers who are not in well informed about these kinds of diseases, which is really preventable by the vaccines. And mind you, they still keep on saying these vaccines might be the cause of the child's demise,
I heard about
or but it's actually no, it's actually not true, because these children really need the vaccination itself. It's not it's the other way around. It's the one protecting the kids rather than causing the diseases itself.
that. And just to correct certain perception also from parents. So you
Yes.
already cited one of them. Some parents would think that it's the vaccine that's causing the causing harm on the child, no, instead of kanang preventing the harm. What are the other myths, Mansad, that you are hearing which we need to correct?
Other
Aside from it's the vaccine causing the harm,
The harm.
rather than preventing it.
other is the side effects of it. So they say once they got the shot, they might have the fever or they might have the measles. We still don't we cannot be assured what the adverse effect will be. Okay? It's not 100% sure that a child will not react. It would always depend from person to person, child to child. Nobody has the same adverse effect. So one might have the rashes, one might have the fever, or one might have none at all. But mostly, none of all will have an adverse effect.
So what you're saying is the majority, it's like nothing
Nothing
happened.
happens.
But for some, it could be fever, it could be
could be
rashes,
rashes.
but these are normal.
Yes.
Okay. Now, just in case, sige, in that context na lang, for parents that they brought their child to immunization and then they see rashes, what would be the most rational reaction a parent should do? Like bring back the child for check, or that's just, oh, that's normal?
If the child, prior to the immunization activity, if the child already has the rashes, then of course they need to check. But if the child will have rashes or fever after the vaccine given, then they need to be checked again. So they
okay.
need to go to their nearest LGU or health center or RHU. So that's the best way, because sometimes when we do the injection, it's in the morning, and then the rashes or the fever might come in the late night. So might as well in the morning immediately go straight or to your nearest emergency room.
So what we're saying, Doc, just for me to clarify it, is most children no effect.
No effect.
But for those with
I mean, not no effect, no
But
adverse effect.
no adverse effect. And then for some, that's when they would experience fever and rashes. And so parents should not also just neglect it,
Yes.
but they also need to bring their children back, no,
Yes.
and have them checked.
If they are feeling, if the child is feeling sick after the immunization, then they should bring back the child, because it might not be related to the vaccine itself.
Oh,
or
yeah, correct.
it might be related to the vaccine. So we still need to investigate if there is any relationship with the vaccine.
Now, aside from programs such as this one, Doc, what are also the steps that DOH is taking to correct misconceptions such as what you mentioned?
One of those steps is like right
Yeah.
now what we're doing, our information drive is really up to the peak right now because we are going to have the MR-SIA, what we call. Um, and I hope the parents will be really well informed right now. And I hope these parents who are well informed will have their children vaccinated. But the other steps is, of course, we're also having coordination meetings with a lot of our stakeholders so that we could not miss out a single child.
So, assuming, Doc, that, for example, I'm a parent, although I am not, but just in case I'm a parent and my child is already part of the 20%, meaning they've already been immunized, do I still need to bring my child to DOH or the
Yes.
LGU? Okay.
Yes, of course. You still need. That's why it's known as supplemental immunization activity, or siguro we can say in the private that it's somewhat like a booster shot. So it would boost the immunity of a child. So what we're having, the our guidelines right now is from 6 months to 59 months before a child would reach at the age of 5. So that's the best way we can protect these children if there are measles infection, especially around the environment right now.
So now again, if ever I'm a parent and then my child is part of the 80%, meaning I have not immunized my child. So can I go directly to this, or do I have to pass through the regular immunization, or can I get the boost, or can my child get the boost already?
Okay. It would depend upon the
Okay.
age. So if you're between, again, 6 to 59, you can directly
Get the boost.
get the booster. But our regular or routine immunization is from 9 months and 12 months. So meaning at 9-month old of the child and 12-month old of a child, they should have the measles-rubella vaccine.
First.
MMR, measles, mumps, rubella vaccine. So
First,
first 2 doses, 9 months and 12 months. And then you can already give the booster. But what we have right now is we need to give them, even without the first 2 doses, we need to give them the MR vaccine. It's still doable.
So again, in my case, Nasad, sige,
Ayan.
if I were, for example, a parent, and then I don't have the usual access to information, how would you normally explain it to me
Ah,
how a vaccine actually works?
now that's hard. Okay,
Sige, oo.
because how vaccines work,
And why
i-
should my
i-
child have it? Sige, ganun.
it's really like a broad on how it would work. But basically, the children, 80%, the children in your schools, the example kanina was, that was a really good
The
example.
practical
Yeah,
one.
the practical one that we can always give to those mothers that who are questioning why do they need the vaccines or how does it work. It's basically that how it works. So
Sige, so with respect to katupong kanang the at least that's the current estimated data now, which is 20%. How much of it also is hesitancy of parents, and how much of it is really location?
okay, for the hesitancy, we don't have that kind of data of how much.
But your gut kon lang, are they more because parents are hesitant, or is it really because layo gid sila?
It's actually parents are hesitant.
Amaw gid siya.
Because if you're going to say because of accessibility, no, because we need to have a temporary fixed post as to where the nearest of the children are. So that's where they need to go. And it's somewhat like the healthcare workers are already going down to that level, up to the point na we want to meet halfway
Halfway.
with the parents. So it's more basically on them hesitant in going to us.
Okay. So we're not seeing access as the main problem.
Yes.
It's hesitancy of the parents
It's
now.
hesitancy of the parents because, again, of the misconceptions or the misinformations they have.
So now let's talk about, okay, because you mentioned governance is also part of is also a factor, no?
Yeah.
Maybe this is a good time also for what are the best practices that you have observed on certain LGUs that they don't struggle as much as the others in terms of immunization coverage?
There are other LGUs who really, really support the health, meaning some of them gave support, such as even for the transportation of these healthcare workers,
Kuhaon yun.
kwaon ihatod, because those vaccine that we place in a very small carrier that we have, a pre-qualified carrier, those vaccines, the measles rubella vaccine, is so sensitive to heat. So that's why we cannot do house to house because of that sensitivity of the vaccine. Now, if we're going to do house to house, there might be a high cases of adverse effect of immunization. So that's one of the things that they're looking at. So we're trying to have a fixed post. So it's up to now to the parents who would go. Now, those are the best supports that the other LGUs are giving to us, and I commend them for that.
Maybe you'd like to commend them now. Okay, sige.
It's actually
leave it at that.
yeah,
Sige,
we leave
okay.
it at that because
Okay,
there
I-
are so plenty of them. I
Ah.
cannot mention all.
Okay. So at least it's comforting to know that there are more LGUs who are really supporting this, no?
Yes.
By at least transporting the parents and their child, no, to where the availability
Yes.
of immunization is.
Yeah, because I've tried once in like about 2024, 2023 during the MR-SIA again. I've tried that. We have walked a very long pathway because the transportation was only up to this certain area, and you know the point na you cannot point to where the house is,
I
but
can
only
imagine.
your mouth say there. Right?
I can imagine.
So that's how far we have been trying to reach the families na up to the point where we will be the one to go near to them.
There's one ad. I don't know if it's the DOH that spearheaded the ad. But when I was a baby, when I was a kid, baby again. When I was a kid, I saw an ad that actually would end with this tagline or line: "Maraming namamatay sa maling akala." So now, with respect to measles, for example, what are also, how would you explain to parents who will just dismiss it? The other one is katong overprotective of their child. But there are also parents na kanang kampante lang now. That's just measles. The child will outgrow this anyway. It's just a phase. What would you tell them?
We shouldn't be complacent. Even for those overprotective parents, we shouldn't be complacent, or meaning we shouldn't be
Like saying it's just a
let's-
phase.
Yeah, it's just a
Pangbata
phase.
ra na.
Pangbata na siya. They would outgrow it. It's better na matakdan rather than
Oh, yeah.
mavaksinan.
That's another
Oh,
myth.
that's
Correct.
another myth.
Okay.
Okay. It's better to have the vaccine itself. Why? Because we are taking care of the future of our child. Because the complications that a child might have during the measles is debilitating enough, and we are afraid that they might have those complications such as encephalitis or up to the point of having death. So that's why we do not want, DOH wants to have the MR-SIA in order for us to cut these things and be informed.
And by the way, thank you for raising that because that's a common myth that I would also
Yeah.
hear, no? Nga mas may pagmatakdan nga bata pa para ma-immune na siya.
Para ma-immune siya. I mean, that
I've
we grew
heard,
up with that.
I've heard about that, no? And then the other thing is katong bata pod nga nagka-measles na, it's even still good for them to still get the immunization, no? Just to
Yes.
correct that perception kay.
As
Humana
long,
naman siya.
as long as they are healthy, they do
They
not
still
have the
should.
measles right now. So, pwede ra gyud that they can have the measles vaccine.
Now this one is kaganina I was addressing more governance on an LGU level. Now if we are to zoom out, and I don't want to put you on the spot, but are there countries also in which they already have zero cases and they already have good coverage? Okay, anyway, the president is going to have his sona basin masingit pa ni
Masingit.
ang imong kuan. President i-appeal ni. Okay. And then it's still 12:30, so nag-make up siya, naminaw siya na. Okay. Sige.
I mean, it has been part of
Okay.
the president's SONA for, I think, from the previous na SONA. So, because of, we have really a low coverage of the, what we call the FIC or fully immunized child, or those that have the, until the measles, mumps, rubella na vaccine, routine vaccine. So since we have that low coverage, but in the other countries, I don't think I'm not sure. I don't want to be quote unquote if there are countries
Zero
na
cases.
nag-zero cases sila, because for example, Filipinos will go to another country,
And
we
they
are
have not
also
been
bringing, and they
immunized.
have not been immunized, then we are bringing the infection to the other countries also. But there are still other countries that also has a low coverage, the same as us. So it's commonly here in the Southeast Asia area. So we do not want the spread to be more. And of course, the Philippines is a tourist area, bringing children with them, families.
And it is a hub.
Yes.
That's why there is an infighting in the West Philippine Sea. Just kidding.
Yeah.
So the more it's urgent, no?
So that's why we need not just us to be protected, but actually even foreigners should also be protected. So because if they're going to have a vacation here, we have to make sure they're having a good time rather than being admitted at a hospital.
And then now we're zooming out ni Doc, no? So that means we're already towards the end of the conversation. So now ni gawas ni ta sa global, mubalik ta to the Philippines, but this time are there any immunization for certain diseases also aside from measles and rubella, which you need to tell our parents also kay murag sa imong mabantay murag hinay sad sila ani nga part aside from measles and rubella?
Yeah, we have BCG. We will start at the BCG. BCG is for the primary tuberculosis for children. Okay.
Hina po ng parents.
Yes, naiuban hina, but we need to give it during within the 24 hours period of after birth.
Oh.
So BCG and
automatic
Hep B
unta siya.
dapat automatic siya.
But parental consent man gud gyapon, no?
Yes, na magyapon goy mo consent. Na say uban dili mo consent.
So I hope they will nakaroon.
So another one is hepatitis B. Okay, why B? Because we are afraid that they might go into the liver cirrhosis. Okay, and then we have at 1 month and a half. So we need to give the penta and the oral polio vaccine. Then we also have the IPV and the PCV. There's so many vaccines. And then up to the point now, we're going to give the MMR vaccines at 9 and 12 months.
And you've mentioned actually polio, no? Okay, I'm with Rotary. And our drive is zero incidence
Yes.
of polio. So actually now it's also an education for me ba na if I am a parent and then one of the responsible things that I need to do is to make sure that the essential immunization
immunization,
for the baby, no,
The
should be
routine
there. The
should be
routine
there.
should be
That's
there.
why we wanted to strengthen it more, the routine immunization. But however, again, the hesitancy is still present.
So now, with respect to, because you mentioned that the DOH is also strengthening information drives now, how can schools also help in this area?
For the schools, the daycare, we are trying to reach out with our DSWD counterparts, and we already have our stakeholders meeting, and they're also very supportive, and we're trying now to the LGUs will try to go to their daycare centers. Now, in the other side, if we're going to have at the school level, elementary, we also have what we call the school-based immunization. And that would be the next one after MR-SIA.
So, if there's any message that you wish to communicate to parents, to the president, and to anyone who's watching us today, what would that be, Doc?
I hope the parents would be more well-informed. Mahirap, you're the previous
Maraming
time,
namamatay
maraming
sa maling
namamatay sa
akala.
maling akala. Or for me, what I did previously, be a good chismosa. Oo. Because you need to be well informed. Do not just, think na it can harm your child or children. It can always help out your children and their future. So you have to secure it to them.
So, thank you very much, Dr. Faith, for joining us. And you have anybody to give your shout out before I let you go?
I need to give a shout out all to my FHS family. Hi and hello to them. That's all. And to the ones who are with me right now, Miss Maricar and Miss Biana. Thank you.
And we're truly grateful to have you here on the show so that we would be able to educate, hopefully,
Yeah, hopefully.
better educate our viewers regarding measles, rubella, supplemental immunization activity, and other essential vaccines, that our babies should have.
Last. If they have questions, right, and if they need an answer, they can go to their nearest RHU or PCF or primary care facility or any health worker that they can find.
And
That-
thank you once again.
Thank you also for giving me a chance to be here.
And thank you also for saying a portion of my closing script.
Oh,
But anyhow, so to our viewers, reliable information can save lives. So I'm DJ Moises. Headlines tell us what happened. Understanding tells us why it matters. So let's look deeper and think better. So this is Beyond the Headlines. Have a good afternoon.
It starts with a fresh shot of espresso. Bold, rich, pulled just right. Then comes the milk, steamed smooth, creamy, and balanced. The perfect latte is not rushed. It is crafted, one cup at a time. Your perfect latte is ready. Coffee first, then everything else.